Service delivery at the primary healthcare level is more critical than ever. It is with great pleasure that the Community Health Practitioners Registration Board of Nigeria, CPRBN, unveils the 2024 revised national standing orders for the 3 professional cadres within the community health practice: community health officers, CHOs, community health extension workers, CBOs, junior community health extension workers. This comprehensive and standardized guide has been meticulously developed through the collaborative efforts of the board and other key stakeholders. It serves as a vital operational reference designed to streamline clinical decision-making, enhance professional accountability, and ultimately elevate the standard of care provided across all levels of community health service delivery in Nigeria. In essence, the 2024 National Standing Orders represent our collective commitment to improving healthcare delivery and safeguarding the well-being of all Nigerians. This revised edition embodies the principles of standardization, accessibility, and excellence in community health practice. We firmly believe that this document will act as a catalyst for positive transformation across the primary healthcare landscape, reinforcing efforts toward achieving our national health objectives. Therefore, I wholeheartedly endorse the 2024 edition of the National Standing Orders to all licensed community health practitioners, the end users, as a critical tool for delivering quality, affordable, and uniform care within the national health system.
Now, one of the physical examination you must conduct as a healthcare worker or a skill-based attendant for a newborn is you must measure the temperature of the baby. And this is expected to be within the normal range of 36.5 to 37.5 degree centigrade. And one would wonder, why do we need to perform this procedure? One, it will help us to detect if the baby is having hypothermia or hyperthermia. That is, to detect if the baby is having high fever or low temperature, or even the baby is having ordinary fever. Remember, newborns are especially vulnerable to temperature instability. Their temperature are usually not stable. And why? Because of what is known as they have a large surface area relative to body weight. Therefore, they tend to lose heat more faster. Another reason why babies are prone to temperature fluctuations or changes is one, they have limited subcutaneous fat for insulation. That is, they have very little of subcutaneous fat that should protect them and keep them warm. Another reason is they have an immature thermoregulatory system. That is, the regulatory system that is in charge of maintaining the body within a normal range of temperature. So because they are still a newborn, this thermoregulatory system is not fully matured. Now, we are trying to look at why you need to take the temperature of the baby as part of physical assessment for the child. And we've looked at reasons why we should, for us to detect hypothermia and hyperthermia. And then we said some reasons why babies are prone to these temperature fluctuations. And we cited large surface area relative to body weight, limited subcutaneous fat for insulation, and also an immature thermoregulatory system. Then, if a baby have hypothermia, that is low body temperature, what can it lead to in the baby? It can lead to low blood sugar. That is not hypoglycemia. It can lead to breathing problems. It can also lead to metabolic acidosis. It can also increase risk of infection. So, this is reason why we need to take the baby's temperature, so that we can detect hypothermia and hyperthermia. And if a baby has hypothermia, that is high body temperature, it can be an indication for us that the baby might be having infection or sepsis, which the baby may have acquired them while the baby was coming out from the mother's birth canal. So, taking of the temperature of the baby is very necessary to detect hypothermia and hyperthermia. Another reason we need to take the baby's temperature is for early detection of neonatal sepsis. Remember, an abnormally high temperature is a very early sign of infection, particularly neonatal sepsis. And if this is not detected early, can progress rapidly and may be life-threatening. So you see, that procedure, temperature assessment, is very critical for the care of the newborn. Then another reason why we need to take the temperature of the baby is to assess the effectiveness of the thermal care. You know, one of the care we give the baby is thermal protection. For example, the skin to skin care or the kangaroo model care. So when we take the temperature, we will know whether yes, this kangaroo model care KMC is actually working or not. Then lastly, it will help us to have a baseline data of the baby's temperature. So in a nutshell, we need to take the temperature of the baby or the newborn because it is vital sign and it tells us the thermoregulation ongoing in the baby. It also might expose the risk of infection and how the baby is doing. So you need to learn how to take temperature of the baby and also make sure you adhere to this protocol as part of routine physical examination that must be performed on a newborn. The next thing you must perform is to conduct a thorough physical examination of the baby, paying closer attention to identify presence of birth defects. And why do we need to carry out a physical examination? We need to look out for birth defects in a newborn very early, because when we detect them early, we'll be able to institute interventions such as treatment or, where necessary, referral. As such, that will improve the overall health of the baby and also support the normal development of that child if detected very early. Another reason why we need to conduct this thorough physical examination is for us to detect some birth defects that are life-threatening. Certain congenital anomalies, such as the heart defect or the diaphragmatic hernia, really requires immediate attention. If not, can lead to serious emergency and might even take the baby's life. But if detected early, interventions such as um, surgery, medication, and monitoring can be carried out on the baby. And also, it will also help you as a healthcare worker to know the parental counseling and care you will give to the mother as part of your health education. How to counsel the mother about the condition of the baby. And what are the likely common birth defects you might see in a newborn? We have the cardiac defects, that is, the problems affecting the heart. And one of them is a congenital heart disease known as ventricular septal defect and teratology of Fallot. So, what are the clinical signs that you would see and this baby might be having this cardiac defect? One, you are looking at the baby, the newborn, and the baby is cyanotic. That is, the baby is bluish in color. And you know that cyanosis is a sign that there's not enough oxygen. So therefore, it has possibility that the blood circulating through the heart is not receiving enough oxygen. maybe due to a problem from the lungs of the baby or from the heart. Another sign is heart murmurs. You begin to hear some abnormal sounds in the heart. Instead of the normal lub dub, you may hear lub dub dub, or lub dub tap, that kind of murmurs or gallop sounds. Another sign you might also see is low oxygen saturation, and that's where we use our SpO2 equipment, that is the pulse oximeter, to detect. So when you see this, that should be a pointer to you that this child might be having cardiac defect. So therefore, there's need for referral. And such conditions require immediate referral for interventions. Another congenital defect you might be looking at for is the neurological defect, such as the neural tube defect. This is very much common these days. The spinal bifida, and also the anencephaly. These are common birth defects that you might be looking at for when you are carrying out physical examination of the newborn. Also, you might also see hydrocephalus, that is enlarged head and bulging fontanelle. They are very much obvious when you see them and requires timely referral from your facility to the tertiary level of care. You might also notice some craniofacial abnormalities, such as the cleft lip or the palate, or small jaws. You might also notice low set ears, flat nasal bridge, which are indicators of genetic syndromes, like the Klinefelter syndrome and trisomy 23 and all of that. You must also notice musculoskeletal defect, such as the club foot or polydactyl or syndactyl, that is extra digits of the fingers or fused digits of the fingers. Then you move down to genital urinary abnormalities. You might also notice in the genital region of the newborn hypospadias. That is when the urethra opens on the side of the penis. Instead of the tip of the penis, it opens on the side of the penis. Then you might also notice undescended testes, known as cryptorchidism. Then you might also notice ambiguous genitalia, that is a genitalia that is not differentiated, whether it's male or female, and that requires urgent evaluation. Then respiratory system defects might also be noticed, so that the baby is having difficulty to breathe, or less if the baby is crying. And that is a pointer of blocked nasal passage. Other things you might also notice includes chromosomal syndrome, like the Down syndrome, trisomy 21, and all of that. So performing of thorough physical examination is very important and critical for the care of the baby. So when you are done carrying out temperature assessment, you must also conduct a thorough physical examination. I call it cephalocaudal approach. You must start from the head to the foot of the baby.
Delaying the bathing of a newborn until at least 24 hours after birth is a recommended evidence-based practice endorsed by the World Health Organization, WHO, and many national neonatal guidelines. This simple intervention has important physiological and programmatic implications for improving newborn health outcomes, especially in resource-limited settings. 1. Physiological basis for delayed bathing. Prevention of hypothermia. Newborns lose heat rapidly, especially through evaporation if bathed too soon. Bathing in the first hours can cause dangerous drops in body temperature, hypothermia, which may increase risk of hypoglycemia, suppress immune function, increase neonatal morbidity and mortality, particularly in preterm or low birth weight babies. Delaying bathing supports thermal stability as part of essential newborn care. Protection from infection, vernix caseosa. The vernix caseosa, A white, creamy, cheese-like substance on the newborn's skin has antibacterial and antimicrobial properties, acts as a natural skin barrier against pathogens, helps retain moisture, and maintain healthy skin pH. Early removal of vernix by bathing may increase the risk of skin infections and sepsis. ACT supports skin maturation. Newborn skin is immature and delicate. Delaying bathing allows the skin to naturally adapt and mature without disruption. Promotes early bonding and breastfeeding. Immediate bathing interrupts skin-to-skin contact, delays early initiation of breastfeeding, and may reduce maternal-infant bonding. Early breastfeeding provides colostrum, rich in antibodies, promotes uterine contraction, and reduces postpartum bleeding. Reduces neonatal mortality. 2. Programmatic implications. Improved neonatal survival rates. Incorporating delayed bathing into community and facility-based newborn care programs reduces mortality, especially in low-resource settings where hypothermia and sepsis are major killers. Standardization of care by birth attendants. Training skilled birth attendants, SBAs,